Hello everybody, we are just continuing that a little bit talk about oppositional defiant disorder that we are discussing for the last few weeks. So we are in that things, it is just like treatment options. So basically you need that because they if untreated maybe risk of depression and obsessional deficient disorder if not treated, that is risk of depression and substance abuse. And according to some of the treatment option that lies include anger management, cognitive behavioral therapy. Then psychiatrists will work with the children and they will teach them how to anger management, how to communicate, how to impulse control, and how to problem solve, all these things that they will work with them together. And of course that is also able to identify potential contributing factors for this. So family therapy is very important. So whole family needs to work together with psychiatrist, and then that parents can find the strategies to help the child with ODD. And parent-child interaction therapy is another thing that therapists coach the parents how to interact with their child with this problem, and then they can have more good parenting technique. Peer groups can learn how to improve their social scape and relationship with other children. Medications, if there is related with any depression or ADHD, then only the medications comes. Other than that, there is no specific treatment for ODD. It is not any medication can this. Now strategies to manage the oppositional deficient disorder for parents, that increase the positive reinforcement and reduce the negative reinforcement, and using consistent punishment for bad behavior, and predictable or and immediate parenting response, and modeling the positive interaction in the household, and reduce the environment or situation that trigger. If there is lack of sleep, then like example for that, and then you have to make sure that they can get that proper sleep. So these are all these things that things. And if that is in the classroom, then teachers can have this up. They have that strategies for the teachers, behavioral modification treatment that work on other student may not work on the student. You have to ask the parent which is most effective, and clear expectation and rules that should be there. And classroom role should have the visible, that what are the rules, it should be visible, that the child can see that quite clearly. Any change in the classroom setting can be upsetting for the child, so had to be very clear about it, and they have to know them very in advance. So hold the child accountable for their action. Try to establish trust with the student by communicate clearly, and it should be very consistent. So basically this is a really important to know and take help for the child with that. So basically sometimes it is a conduct disorder can be confused with oppositional defiant. So oppositional defiant disorder is a risk factor for conduct disorder. So basically that is why it is important that can be, you can see that gradually that illegal things they can do later on. So it's important to treat them as early as possible. So basically and then we are just on that way, we try to give you an outline so that it must be helping you, and hope it will help you to increase the awareness about that disorder. We'll do another little talk next week again. Bye bye for today.